Ghana is currently rolling out healthcare system that could save millions of lives for free.
One key aspect of the free primary healthcare is preventive, to identify the illness and get early treatment before it develops into something else.
No insurance, no paperwork, no pay first before treatment, but actual healthcare at the community level.
And so a major part of the free primary healthcare is the health screening aspect. And we are encouraging that when we roll out the free primary healthcare, our traditional leaders and our religious leaders will help us to mobilize their communities.
All for free. And here is the shocking part. Ghana already had free healthcare insurance. So why introduce something new? And what exactly is this free primary healthcare program? In this video, I unpack it for you. And all that you gotta do is to send money from Europe, UK, Canada, America to Africa using Lemfi. And it is 100% free of charge. You even get £10 for free if you decide to use my code KWEKUAFRICA. If you use it, you are going to get £10 for sending money without any charges.
Guys, if you've enjoyed this video so far, please do me a huge favor and hit the like button and subscribe. These videos take quite a long time to make, so if you could help me out, I'll love you forever. Thank you all for your support. Now let's get back to this crazy story.
Bessa GA.
Ghana's President John Dramani Mahama has launched Ghana's free healthcare program in Dodowa in Accra. And this is completely free at the first point of contact. So what are we even talking about? We are talking about free OPD consultations, free basic treatment, free maternal and child health care, and free preventive services. And you are also given essential drugs all for free. And all of this will be given not at the bigger hospitals in Accra, but at the primary level facilities like Chiefs Compound and district clinics for free.
Normally, the health scheme, normally for most of the health facilities under the health scheme, you see the patients only when they are sick. And so it's mostly curative. One key aspect of the free primary health care is preventive, to identify the illness and get early treatment before it develops into something else. And so a major part of the free primary health care is the health screening aspect. And we are encouraging that when we roll out the free primary health care, our traditional leaders and our religious leaders will help us to mobilize their communities. At least every Ghanaian must be screened once a year. Every Ghanaian must be screened once a year. And you get the basic screening, and that includes hypertension. So the free primary health care posts would have the manometers so that they can check your blood pressure to see if you are developing blood pressure. Sometimes if you are developing blood pressure, just a change of your diet can take it away. A change of lifestyle can take it away. But if your blood pressure is high and you require treatment, then you will be referred up to the district hospital level.
The question that people are going to ask is that, didn't Ghana already have a free health insurance? And yes, the answer is Ghana already has National Health Insurance Scheme for free.
So the free primary health care complements the National Health Insurance. And so at that level, it's free of charge. You go, the screening, everything is free of charge.
So there is a National Health Insurance Scheme for Ghana. But what is the difference? Now, let's break it down clearly. Now, let's look at the difference between the National Health Insurance Scheme and the free primary health care. Now, this is a simple explanation. So the NHIS or the National Health Insurance Scheme, the old system, you register and then you pay premium. Then you get your insurance card. Now, this covers your treatment, but there's been delay in services. A lot of drugs are not covered. So you go to the hospital, and once you take out your health insurance scheme, they will start dragging their feet, okay? And then after treatment, they will tell you, go to private hospital, buy this, buy that. We don't have this medicine. The health insurance doesn't cover this. So it's like it's free, but you have to pay for. And some hospitals even reject the National Health Insurance Scheme due to debt. So, government was unable to pay. Sometimes we see that, this hospital, we've not paid us our NHIS for this month, so we've canceled the National Health, a whole lot of hula baloo, okay? So, although it is functioning, it is struggling. Now, let's look at the free primary health care, the new system. So, the new system is going to be like this. There will be no registration stress. You don't have to go queue to register. Number two, there will be no payment at the point of care. We also focus on basic everyday health care, which is delivered close to communities. To focus on basic everyday health care, and it will be delivered closer to communities, and government will fund all of this directly.
We are moving from sick care to health care. Your Excellency, by 2030, we expect to see out-of-pocket expenditure fall below 20%, to see over 95% of Ghanaians accessing essential primary health care services, to see reduced congestions at our hospitals, and to see a stronger, more resilient health system. This is how countries achieve universal health coverage, and this is how Ghana will achieve it. Mr. President, I am pleased to report that we are ready. We have completed the costing and financing frameworks. We have initiated the necessary legislative reforms. We have strengthened coordination across the Ministry of Health, the Ghana Health Service, the Christian Health Association of Ghana, the National Health Insurance Authority, and our partners. We have procured over 24,000 pieces of essential medical equipment, including incubators, glucometers, hospital beds, and ultrasound machines to support services delivery across the country. We are advancing digital health systems to ensure transparency, monitoring, and accountability. Over the next 2 months, Ghanaians will begin to see this transformation in full action.
So government will fund it. So in simple terms, the NHIS is equals to insurance system, right? Insurance, just like your company, your school, you want to do insurance. Everybody pays that. At the end of the month, maybe 3 people will get sick. Then the funds from the other 7 people will be used to take care of you. Now, this one is free primary health care, which is service delivery system. So those are the differences. This move will solve a big problem. In fact, many Ghanaians don't go to hospital early. Why? Because of cost, because of fears, long queues, insurance issues. So people wait until it's too late. That is the problem this is going to tackle. This new system flips that. Now, it focuses on early treatment, prevention over cure, and decentralizing healthcare. So this is how it's going to work. Now, let's make it practical. So imagine a mother in a rural community. Now, before she needs NHIS, she needs to travel very far and pay extra fees. Now, she only walks into a nearby chief's compound, get treatment immediately, and pays nothing, and even better. And so to make it easy and accessible, the government is deploying motorbikes, community health workers, and mobile outreach. So in short, healthcare is now coming to the people.
Kweku Africa, rise up Africa. Voices rise from coast to coast, telling stories we need most. Truth and power, clear and strong. Africa's heartbeat in our song. Kweku Africa, bold and free, telling our...
Now, President John Dramani Mahama also advised people to stop or avoid eating heavy food after 7 p.m. in the evening. Myself, it's a big advice for me. I need to stop so that my belly fat will go down.
Please, by 7 o'clock, eat your dinner and don't eat again. If you are hungry, just take some cup of tea or something. Don't eat any heavy food. Banku in the evening, you come from work in the evening, and then your poor wife is tired. Come and do banku, come and stir banku for me at 10 o'clock in the night. Why? So, an aspect of the free primary health care will be education on how to maintain a decent lifestyle. Our fathers and co used to eat banku and kuku late in the night, but they were physically active. They used to go to the farm and they expended energy. Now we don't do any physical activity. You wake up in the morning, no exercise, you eat breakfast. They used to walk to the farm. You go and take your car, drive to work. When you go to work, you go and sit behind the desk from 8 to 5. You close, you take your car again, you come home, and when you come home, you say, "Where is my banku?" What physical activity did you do to deserve banku? You know, so change of lifestyle will be part of the educational activity of the free primary health care. And then we're going to have a category of them. The health professionals in our church compounds and other places would be the ones who would be the primary administrators of the free primary health care. Now we're going to have a category that we call health volunteers. This will include national service people. It will include nurses and other paramedics who have finished school and are waiting for posting. We'll deploy them in the free primary health care service. until when it's time for posting. For those who volunteer and take part in the free primary healthcare, when it's time for posting, we'll give them the priority in terms of posting. And so the health volunteers, they will go from place to place. Some of them will work in the what we call the health kiosks. Others will come to the community with all the equipment, and then they can sit under a tree, and then you just come and take your test quickly.
What is your take of this free healthcare system in Ghana? Is it a good policy, or you think it's same old story, different script? Leave your comment in the comment section for today.